Every couple has the right to conceive a child, but according to the recent report by the Dubai Health Authority, there are over 100,000 men and women facing infertility problems in the UAE. There are many factors that affect fertility, and for those couples who are trying to conceive naturally but are finding time and time again they are unable to do so, it can be both stressful and detrimental. But one solution that is garnering more attention across the country is in vitro fertilization. IVF has brought hopes to thousands of childless couples across the UAE. However, there are still misconceptions about what the treatment is and how exactly it works. We sat down with Dr Michael Fakih, the founder of Dubai's first private IVF clinic. He has over 25 years of experience and is responsible for over 10,000 IVF deliveries. And according to the doctor, IVF is here to stay. Firstly, thank you very much for joining us today.
Thank you very much for having me.
Now, you opened the first private IVF clinic in Dubai in 2011, but you have over 25 years of experience in the industry. Let's begin by dispelling the misconceptions. What is in vitro fertilization and how does it work?
Well, in vitro was first established in the late 70s when we had the first baby, and the premise was use it in women who had blocked tubes. So the egg and sperm cannot get together and fertilize, and there's no embryo, so there's no pregnancy. So basically, this was the initial cause of doing IVF. With time, the indications have really increased, and now you do it for many other reasons, like sperm problems. In the past, we used to tell couples that had problem with sperm, your only option is to do donor sperm. Now, actually, we have procedures where you can inject the sperm into the egg, create an embryo. Even though there's no sperm or minor sperm, like a small sperm number, you can still do it. So you can take the sperm directly from the testicle, inject it into the egg. So now the indications have really increased from just tubal disease to male infertility to women who have issues with ovulation and they're not responding to the hormones. So all these have really added to the indications and increased the number of patients that are coming to do IVF. And it's really been very, very helpful in the sense that many babies have been born with this procedure who otherwise don't have seen the day of light. So since the first baby was born, there's like millions of babies have been born with IVF. There are hundreds of different units all over the world. And in Dubai, as you mentioned, there's like 2 or 3 units. In Abu Dhabi, there's almost the same number, and the number of cycles are increasing with time. So IVF is here to stay. It is growing because the demand is growing, and we'll talk later about the reasons why there is more infertility patients.
What are the most common causes of infertility, and is it an issue that only concerns women?
No, the number one cause of infertility, believe it or not, is male problems. So about 60 to 70% in the UAE of infertility cases have to do with male infertility. What happens here is you can either have low count of the sperm, you can have slow sperm, you can have abnormal sperm morphology. And most of this is related to lifestyle, whether you're obese, if you're hypertensive, taking medication can affect it. If you're diabetic, it can affect it. And here, you know, there's a prevalence of these diseases, obesity, diabetes, hypertension, and this adds to the problem of male infertility. Many men come to us with no sperm at all, and this probably has to do with consanguinity in their parents. You know, here, like, couples can be cousins and intermarriages and all this. So this increases the chances of diseases otherwise you don't see in the West. And this is why male infertility is very, very prevalent. So this is like the number one cause. Other causes include polycystic ovarian disease, which is also very prevalent here and also has to do with lifestyle. And you can have tubal disease, which mostly comes from infections. So the patient's tubes are either blocked or there's scar tissue around them. And also there is another category which actually is induced by doing unnecessary surgeries. If a woman has an ovarian cyst, instead of opening up her abdomen or doing laparoscopy and remove the cyst, you can simply just aspirate it vaginally. just by avoiding big surgeries on the ovary itself, will reduce the scar tissue incidence and will improve the fertility potential for that particular patient. So these are in a nutshell, the most prevalent cause of infertility in the UAE.
Could you talk to us about some of the groundbreaking advancements you have seen develop over the years in infertility treatments?
Yeah. Well, IVF itself was the major breakthrough that happened in the late 70s. And then since then, many things have really changed. The one thing which really made a big difference is development in culture media. When we first started in the 80s, late 80s, early 90s, everybody was making their own media in their hospitals. And unfortunately, that medium where the embryo is nurtured for a few days was not very ideal. So we had only like 5 to 6 or 7% success rate. We're talking about the late 80s, early 90s. So improvement in the media quality with time have really increased the success rate with IVF and have made, if you have good clinicians and laboratory people, then you should have at least a 40% success. So had made a big difference in success rate. Also, improvements in the lab itself, going into the clean room concept. Because in the past, we didn't really understand that you have to have filters, we didn't understand that you have to have certain number of air circulations in the room. So the IVF rates were not that good. Now with this concept in mind, this has improved the embryo quality and the implantation rates. So you have a higher success rate whenever you transplant the embryos. So these are two big things that happened. From the clinical point of view, the development of what we call the ICSI procedure, intracytoplasmic sperm injection, has added a lot to the male infertility. Because in the past, when you have a male factor, you put the sperm with the eggs in a dish. There's a very good chance that the sperm not be able to fertilize the egg. And then the next day you come back and see that the egg has not fertilized, and then unfortunately nothing will happen. But since development in the early 90s of the ICSI procedure, you can actually grab one sperm, put in a microneedle, and under the microscope inject this sperm into an egg. And from going from 0% to 90% fertilization rate in this particular situation where you have male infertility, this has added much to the treatment in male infertility. So that also is one of the major breakthroughs that have happened. We can add another breakthrough, which is actual diagnosis of disease in the embryo itself. So if the male or female or both of them are carrying a certain genetic illness, you can actually diagnose the genetic illness in the embryo itself before you transfer the embryo to the woman. So this way you can prevent that disease from happening or avoid it from happening. Another breakthrough is, besides diagnosing genetic illnesses, is diagnosing abnormality in embryo chromosome numbers. So this will prevent or avoid Down syndrome from happening. By diagnosing normal embryos, you increase implantation rate, because then you are finding out which embryo is the better embryo and putting this back in the uterus. And one thing that probably has to be mentioned is that the reproductive system has a lot of wastage. Like out of 100 embryos that you make, you probably only have 20 or 30 that are genetically normal. So if you don't select the right embryos, even though they look the same under the microscope, so you can have two embryos that look the same, and one genetically normal, the other one is genetically abnormal. So the genetic testing has really added much to the success rate and also to the prevention of diseases that can happen in the future. So these are the things that I'm thinking of now that probably are helpful in the overall fertility treatment, also in increasing the success rates with in vitro fertilization.
Now, what is the success rate of those who do choose to undergo IVF, and what are some of the factors that are dependent on this success?
Well, the main factor is the age of the woman. This is it. Like if you're younger, the chance for pregnancy is higher. If you're older, the chances go down. Now, if you're older and can make good number of eggs, then your chances will still be fine. But if you're older, cannot make eggs and have irregular periods, then your success rate is very, very low. So that basically determines the overall success rate. And then obviously you have to have the expertise, you have to have the laboratory equipment, and you have to have the technicians that work in the lab to add and improve the success rate. But that is number one cause of low pregnancy, is the age of the woman. We can probably, right next after this is very bad sperm. Like when the sperm is very, very low, especially in men who smoke. Like people come and say, oh, I just had a patient today who said, my father smoked 100 cigarettes a day and he still had like 3 babies. Why is it affecting my husband if you thought about just smoking? Well, if your husband started with 20 million sperm and then he smoked, maybe half or 60% of those become abnormal. And abnormality, you can't just see it by looking at the sperm quality. You have to do more DNA testing. There's a test, DNA fragmentation test. DNA fragmentation test is becoming a landmark in certain men who smoke, because you can tell, like if you're not smoking, it's probably 20% abnormal. If you're smoking, it can go up to 80% abnormality. And this can add to abnormalities in the embryo itself, and it will lower success rate. So smoking and other bad habits like alcohol and other things can affect the outcome. And we cannot really overemphasize the lifestyle that the particular couple or person is going through and how much it can impact their fertility. So if you want to save money, then lead a good lifestyle. This will improve your fertility rate. And also if you want to get the better outcome from IVF or any similar procedures, you have to really be careful with what you're eating, what you're drinking, and your lifestyle to improve your outcome.
Now, it is a costly treatment. Could you give us an approximation as to how much a couple would need to put aside if they wanted to undergo IVF? And are there support systems to help couples financially?
Yes. Fortunately, in the UAE, the governments have been covering IVF. So this, even though it's a big burden on couples, have lightened the burden some on the UAE nationals. Unfortunately, the other insurance companies do not cover the expats and other people who live in the UAE. And this is where we have to really come up with certain scenarios to try to help these couples achieve a successful pregnancy. So the biggest cost in IVF cycle are the medications. They're extremely expensive. Yeah. The testing is very expensive. And then the laboratory work is not cheap. So if you try to limit some of those items, then you lower the cost. So what we came up with is what we call minimal stimulation IVF, where instead of giving very high dose medication, which is costly, give small dose medication, especially in younger women, to produce, instead of producing 20 eggs, you probably make 4 or 5 eggs. And we found that this does not really affect your success rate much. It can be affordable to many, many couples, and they can do it. So it basically will make you save at least 30% of the cost by doing it that way. Another process we do is where you don't take any medications. So we do what we call natural cycle IVF. So women normally produce an egg every month. So we take this egg out, fertilize it, put it back as an embryo in the uterus. And here the cost will be at least, like the savings, at least 60% from the other type of procedures. So we can basically tailor-make different protocols for different couples depending on their age and what their problems are, and then try to get the best outcome out.
But if you needed to give an approximation?
It's from 10,000 to 30,000. Okay. Yeah, 10,000 dirham to 30,000 dirham.
Now, there are couples who are unable to successfully conceive their second or third child naturally. Could you talk to us about secondary infertility, and why is it that a couple may be able to conceive naturally their first child but not their next?
Yes, we have like at least half our patients come with secondary infertility. So it's a very common incidence, and many of those, again, like have to do with sperm. Yep. Like some men who are healthy when they're younger, they have good sperm, and then when they're like hit with diabetes or hypertension and there are medications, all these medications, the actual disease can affect the sperm count. So we see a lot of this, and also in women, like when they're younger, their ovaries are functioning properly, and then when they're obese and hypertensive, they have less ovulation, and then the medication can affect the ovulation rate. So these come to us with secondary infertility, and other women who probably have contracted infection after delivering the first baby can have blocked tubes or problem with the tube. So there are many reasons why you can have secondary infertility, and usually these are successful cases because they've already had children. So there's no major problem to help them get pregnant again.
Have you ever been faced with couples who were willing to undergo IVF but were concerned that it conflicted with their religious beliefs?
Yes, as you know, there is certain religions where you can't even do IVF. all right? So, like, let's take the Catholics, for instance. Like, one time I gave a conference in a Catholic church in America, and we went over ways where we actually can help Catholic couples get pregnant, knowing that IVF is not an option. So we came up with the gift procedure, like where you actually mix just sperm with the eggs and then let them fertilize in vivo inside the woman, and then this way they can achieve a pregnancy. And the other major concern of Catholics and other religions is that they don't want to waste embryos. Like, you make an embryo, they don't want to throw it away. So they want to make sure that every single egg that has been fertilized is used. So knowing that there's a very high chance of abnormalities in the embryo itself, a genetic abnormality, you can basically always do a genetic testing on these embryos and tell them, okay, like out of these 10 embryos, only 2 are normal, and put back those 2 embryos. All right? In this country, in UAE, you cannot freeze extra embryos, unfortunately. So we try to freeze as many eggs as possible before we actually do any treatment. This is something which goes along with the Catholic religion, where you don't fertilize all the eggs, you can fertilize some of the eggs, and then try to make less embryos, and then try to utilize all these embryos. So between freezing the eggs and then doing genetic testing, you can basically lower the chance of having to throw out normal embryos.
Finally, doctor, when does a couple know when to stop trying naturally to conceive a child and seek IVF treatment?
Well, the most important thing is you cannot, like, if it depends on the woman's age, all right? So if a woman is 37, then the tolerance of waiting for a long time is not as much as if she was 26. So at the age of 26, you can tell them, okay, go try for a year, 2 years, and then see what happens. But there's certain minimal things that you can do which can really reduce that waiting period. At least do a sperm test on the couple. Like, sperm test is a very simple test, and it can eliminate 70% of the causes. If the husband has a sperm problem, there's no need to just keep waiting and waiting and waiting. Same thing with other female issues, like if the female has tubal disease, like if she's at high risk for tubal disease, you can just do a simple test to check the ovaries and check the tubes if they're patent. So from a physical examination on the woman, pelvic exam, and minor sperm test on the husband, you can tell from the beginning if there's any major issues that can cause this couple to have fertility issues. And then you can guide them how to treat them from the beginning, or they can wait a few more months and then you can start treatment early. But if somebody is 38 or 40, then you probably advise them to be more vigilant in when to start the treatment.
Dr. Fakih, thank you very much for your time. It's been an absolute pleasure.
Thank you for having me, and it was a pleasure here too. Thanks a lot.
Well, that brings us to the end of our program. If you would like to get in touch with us, you can contact us at UAE Weekly at city7tv.com or by calling us on 04367 2230. From myself and the entire team, have a great week ahead.